Do you struggle with daytime sleepiness, poor concentration, or loud snoring? One possible cause is sleep apnea, a common condition that many people do not realize they have. Why is sleep apnea important? Research has found that untreated sleep apnea is associated with an increased risk of several health conditions, including high blood pressure, coronary artery disease, heart attack, stroke, atrial fibrillation, heart failure, type 2 diabetes. Sleep apnea has also been associated with an increased risk of motor vehicle accidents due to excessive daytime sleepiness. Having sleep apnea does not mean someone will definitely develop these conditions. What is sleep apnea? Sleep apnea is a condition where breathing repeatedly stops or becomes significantly reduced during sleep. The most common type is obstructive sleep apnea, often called OSA. In OSA, the muscles and tissues of the upper airway relax during sleep, causing the airway to partially or completely collapse. Obesity and sleep apnea. Obesity is one of the strongest risk factors for obstructive sleep apnea. Excess fatty tissue around the neck and upper airway can narrow the breathing passages and make the airway more likely to collapse during sleep. The risk of obstructive sleep apnea generally increases as body weight increases. However, it is important to remember that sleep apnea can occur in people of any body size. Not everyone with obesity has sleep apnea, and not everyone with sleep apnea is overweight. Can thin people get sleep apnea? Yes. While obesity is one of the strongest risk factors, many people with sleep apnea are not overweight. Some people inherit facial, jaw, tongue, or airway characteristics that make the airway more likely to narrow during sleep. Why does sleep apnea cause daytime sleepiness? People with sleep apnea may stop breathing. Each breathing event may trigger a brief awakening or arousal from sleep. As a result, sleep becomes fragmented and less restorative. Symptoms and warning signs. Common symptoms and features may include loud snoring, witnessed pauses in breathing during sleep, choking or gasping during sleep, excessive daytime sleepiness, fatigue, despite spending enough time in bed, morning headaches, poor concentration, memory difficulties, irritability, high blood pressure or difficult to control blood pressure. Some people are unaware they stop breathing during sleep and only discover the problem because a partner notices it. How is sleep apnea diagnosed? A sleep study is the key diagnostic test. Questionnaires can help identify people who may be at risk, but guidelines recommend that obstructive sleep apnea should be confirmed using sleep testing rather than questionnaires alone. What does a sleep study show? A positive finding for obstructive sleep apnea means the sleep study has detected repeated breathing disturbances during sleep. Sleep studies commonly assess apneas, complete pauses in breathing lasting at least 10 seconds, hypopneas, partial airway blockages that reduce airflow and are associated with oxygen drops or brief brain arousals, oxygen desaturation, drops in blood oxygen levels that occur during breathing disturbances, arousal events, brief interruptions to sleep that may fragment normal sleep architecture. Understanding the Apnea-Hypopnea Index, AHI. Sleep apnea severity is commonly measured using the Apnea-Hypopnea Index, or AHI. This records the average number of breathing disturbances per hour of sleep. General categories include mild OSA, 5 to 14 events per hour, moderate OSA, 15 to 29 events per hour, severe OSA, 30 or more events per hour. Treatment options. Treatment depends on the individual and the severity of sleep apnea. Management options may include weight management. For people who are overweight, weight reduction may improve sleep apnea severity. Reducing alcohol. Close to bedtime. Alcohol can relax airway muscles and worsen airway collapse. Avoiding sleeping tablets, unless medically advised. Some medications may worsen airway obstruction in certain individuals. Side sleeping. Some people experience more breathing disturbances when sleeping on their back. Continuous positive airway pressure. is a commonly used treatment for many people with obstructive sleep apnea, although suitability varies between individuals. It delivers pressurized air through a mask to help keep the airway open during sleep. Mandibular advancement devices. These dental devices move the lower jaw forward and may be suitable for selected patients. Surgery. Surgery may be considered in carefully selected cases. Managing cardiovascular risk factors. When should you speak with your doctor? If you have symptoms such as loud snoring, witnessed pauses in breathing during sleep, excessive daytime sleepiness, morning headaches, poor concentration, unexplained fatigue. Sleep apnea, brain health and dementia research suggests sleep apnea is associated with an increased risk of dementia. However, association does not prove causation. Current research cannot confirm that sleep apnea directly causes dementia, and studies in this area are ongoing. If you found this video helpful, consider subscribing to Medical Explained so you don't miss the next episode in our Healthy Aging series. Watch our next video, Dementia Explained: 6 Things You Need to Know. Sleep apnea is also associated with high blood pressure and cardiovascular disease. Watch High Blood Pressure Explained.